Dr. Yoon, I understand you have a unique surgical procedure. Would you mind describing this technique for me?
Well, the conventional surgical method for total hip arthroplasty is cutting the skin about 15 to 20 centimeters. And they go deep into the muscle and they cut part of a gluteus medius muscle or short external rotator muscles. And when we cut the muscle, we have to repair the muscle again, and it takes time for the recovery because we have to suture the muscle, and the muscle should be repaired. But in my surgical technique, I'm not cutting any muscle. Instead, I have to cut the skin about 7 centimeters anteriorly and another incision about 5 centimeters posteriorly. By doing that, we are cutting the femoral neck and insert the acetabular component in the anterior opening. And the second opening, through this opening, we insert the stem into the femur. And we do not cut any muscle. Instead, we use intermuscular interval so that we can, after putting in the artificial joint, the patient can recover right away because we do not cut any muscle. Therefore, the patient recovery is really fast and the final function is much better than conventional surgery.
Are there any side effects?
Well, every surgical technique, like a total hip arthroplasty, we have complications. That is possible, but the rate of complications is really low. And by doing a two-incision surgery, because we recover very fastly, therefore I believe some complications is much lower than conventional surgery. But if you do not have a really good surgical technique, you may have some more complications. But in my case, because I have done more than 2,000 surgeries, I can avoid every complication. So in my recent studies, about 99% I do not have complications.
How soon will I be able to return to my daily routine after surgery?
Well, in our hospital, usually the patients are admitted about 7 days, and they go directly to the home. And usually it takes about 2 or 3 months when they go into the daily life. But the faster patients, even after 1 month, they go home and they go directly to their job. And some a little bit longer time, they usually takes about 3 months. Okay, if the patients get my surgery, usually the patients they are out of the bed from the next day, then they can work. Sometimes they use crutch, and most of the patients, but they do not use any crutches. They can go toilet and they can work, even though there is a mild limping. But usually they stay in a hospital about 7 days and they directly go home. And usually it takes about 2 or 3 months to go back to their daily work.
Will I need replacement in the future?
Well, as I use the articulation, usually a ceramic on ceramic and metal on metal articulation, they are really wear resistant. So usually the problems coming from wear is not a big problem in my surgery. So more than 90% you can expect you do not have second surgery.
How often do I have to return for a checkup?
Well, many nearby patients, they come once a year and just come and take x-ray, and usually 99% they do not have any problem. But long distance patients, they don't have to come. And if they have any problem, they can take x-ray and send it to me by email. But if you want, you can come anytime. Okay? Okay, I hope you understood everything.
Yes, I did.
Okay, is that okay?
Everything's fine. Everything's
okay,
great.
thank you very much.
Thank you very much.
Thank you.
Thank you for your time.
Okay, we will meet again. Okay.
Hello visiting our hospital. I'm Nurse Jean Kim, working in the orthopedic unit. If you come to our hospital, we can provide you best care with all my heart. Thank you.